When you're working with a patient um, who has postpartum hemorrhage, the first thing you want to do is, prior to finding that out, is you want to assess the risk factors for having postpartum hemorrhage occur. So some of the risk factors that I have written down is placenta abruption, placenta previa, if you're having multiple pregnancies, so twins, triplets, quadruplets, gestational diabetes or preeclampsia, which we learned preeclampsia in the last clinical day, infection, which is also known as amnioitis, or prolonged labor. So the first step to perform if your patient has postpartum hemorrhage occurring is you want to notify the provider first, let them know what's going on. Then you're going to want to assess for signs of bleeding and assess for hypovolemic shock. If they have lost too much blood, they will go into hypovolemic shock. You want to turn the patient on the side and estimate the amount of blood that they've lost. You want to massage the uterus and expel the blood clots that are in there. And you want to assess the patient's pain level. And if the patient is in hypovolemic shock, you want to administer oxygen, and you want to routinely check their vital signs to monitor their blood pressure is really important if they are losing a lot of blood. Medications to administer is oxytocin, which forces the uterine muscles to contract, which can help stop or prevent, not stop, but control the bleeding a little bit. To estimate the amount of blood, because the doctor, you're going to want to let them know how much blood the patient has lost. You want to take the pads that contain blood on them and weigh it, and then you want to weigh the same exact number of pads without blood, and then subtract and get the difference, and that'll be how much blood the patient has lost. And then if a patient is wondering like why they're having so much bleeding, you can tell them that it could be from chorioamnionitis, which can increase bleeding during and after delivery. And since we're talking about postpartum, it would be after delivery. And then if there's so much bleeding that they're not able to control, the patient may need to have a surgical operation. So when you're having the patient sign the consent forms, it's really important to make sure that they understand the procedure. They know the instructions that the doctor's given them, and it's very clear to them that they understand what the surgery is going to do. After the surgery, since they've lost all this blood, they may need to get packed RBCs, red blood cells, and important to make sure that you check the patient's blood type. And then O negative is the universal red blood cell donor. So if you're unsure, give them O negative blood.